Thank you, Madam President. Madam President, we are just about a year to the day from the day that the President signed into law the health care law that is going to have an impact on all of the people of this country. Here we are a year later, and we know a lot more about this law. People all around the country know a lot more about this law. And I spent part of the weekend visiting the folks in Buffalo, Wyoming, and attending the Buffalo Health Fair. Now, a health fair is a place where people in the community get together. They get their blood tested ahead of time, very inexpensive. It's based on prevention, early detection, things that this health care law was supposed to address, but again, this health care law has failed miserably. And at the health fair, I talked to people who were getting their blood results back, checking their cholesterol, checking their blood sugars to see if they had diabetes, checking their thyroid levels. And as these people were getting their blood tested, and many people, probably half of the population of Buffalo turned out to have their blood tested, they started asking me questions about the health care law and the kind of questions that any American would be concerned about. Am I going to lose my freedoms? Am I going to still be able to keep my doctor? Will it truly get the cost of my care down? And regrettably, Madam President, this health care law, now a year since it's been signed, turns out it's going to be actually bad for patients, bad for providers, the nurses and the doctors who take care of those patients, and bad for payers, the taxpayers, the people that are going to be left footing the bill. Because we know a lot more now, a year after the law has been passed, than we did when it was passed. People remember this as the law that was crammed through the Senate in the dead of night, written behind closed doors, all of the unseemly bargains that were cut to convince senators to vote for it, getting by on the barest number of votes, things like the Cornhusker kickback, the Louisiana Purchase, the sort of things that offended people all across this country. So people are upset with this health care law, one, in the way that it was passed, in spite of the fact that the President promised it would be seen on C-SPAN. All the discussions were held behind closed doors, and despite the fact that many Americans never had a chance to read this 2,700-page law. And Madam President, when the President made his initial speech about what he was aiming to accomplish in health care, I said that'd be great. I mean, I'm an orthopedic surgeon, practiced medicine for 25 years. I think we need to do the sorts of things that the President initially addressed. Unfortunately, the health care law went in the opposite direction. When people worked their way through the 2,700-page bill, they found that instead of lowering the cost of care, the cost of their care was going to go up. Instead of allowing people to keep the doctor that they wanted, they were going to have to, unfortunately, change in that situation. And that's why I've been coming to the floor week after week with a doctor's second opinion about this health care law. So here we are a year later. We know that the cost of health care is going up. The President said that health care premiums would lower for families by $2,500. No family has seen that, Madam President, none that I know, none that I've talked to in Wyoming, not one. Instead, people have seen the cost of their health insurance going up, not down. The President said, well, he's never going to raise taxes, and then, in fact, there are a lot of tax increases as part of this health care law. Even the 1099 form that Senator Johans has championed on the part of small businesses around the country, the effort to remove these onerous obligations on our small businesses, have nothing to do with health care. Well, boy, that got crammed into this bill in the dead of night so that those who support the bill can claim that it was going to lower the cost. And even the Congressional Budget Office admits that the costs are going up, not down. This is absolutely impacting jobs. The President promised that there'd be efforts for small businesses to have some advantages and some tax credits and some help. What we found out is if you have a small business with 10 employees and it goes to 11, you're going to lose some of those benefits. If you're paying your employees an average of $25,000 a year and you want to give them a raise, you start losing some of the benefits. So in spite of the fact that the President had 4 million postcards sent out to small business owners, very few of them have been able to take advantage of what was promised to them. And now here we are where additional waivers are being given. We're at a point where over 2.5 million Americans have been given waivers from participating in the health care law. And interestingly enough, these are the very people, for the most part, significant number, who lobbied for the bill. Once they found out what was in it, they said, no, I don't want this to apply to me. And now we see that the state of Maine, the entire state of Maine, has been given a waiver. Well, Madam President, I come to the floor today a year after this is passed into law, and I say everybody in the country ought to be able to give a waiver and opt out of this health care law. Opt out completely. These are decisions that should be made at the state level, at the local level. Washington's one-size-fits-all has hardly ever worked for anything, and it sure doesn't work for health care. So in Wyoming, at the Wyoming Health Fair in Buffalo, as I visited with people, talked to them, you know what they're worried about? They're worried about losing their freedoms, losing their choice, losing their doctor, losing the health care plan that they like. In spite of the president's promises, we know that about 80% of people who get their health insurance through small businesses are not going to be able to keep the health care that they like. Why? Because of government mandates. The government has said, no, we know what's best for you. You don't, we do. The government says, we know what's best for your family. Like, the government doesn't know what's best. These ought to be local decisions. And that's why Senator Lindsey Graham and I and a number of co-sponsors have introduced legislation to allow states to opt out of this health care law, opt out of the individual mandate, the requirement that forces Americans to buy government-approved insurance. Let states make that decision if people in their own state need to live under those laws. Let states decide if individuals, if people who are the employers, the people that are the job creators in our communities, if they have to supply government-approved insurance to the people that live there. Let people make decisions at the local level. And then you can lift any newspaper and take a look at what the Medicaid mandates are doing to our states and doing to the budgets of the states. States like Wyoming, where we balance our budget every year, live within our means, are being crushed by these Medicaid mandates. But it's not just small states like Wyoming in terms of population. California, New York, states all across the country are saying to this body, let us out, let us opt out. We can't live under these mandates. But the president's solution is to cram more people onto Medicaid, a program that doesn't work, where many doctors won't see these patients, where the reimbursements are so low, hospitals say, we can't afford to see these patients because of the impact it will have. You know, even the actuaries, the people that look at this, the fair and appropriate way to look at the numbers say 15% of the hospitals in this country 10 years from now may not be able to be open because of the way that this health care law is going. That's not going to provide more access, it's providing less access. And why have seniors rejected this so overwhelmingly? Well, seniors have looked at this and they see $500 billion in Medicare cuts. And things like Medicare Advantage, and there's an advantage to being in that program. That's why 1 out of 4 seniors have set up that program and have chosen that program. It's because they want choice. And this health care law is one that is taking choice out of the hands of the American families, taking the freedoms out of the American families' hands. And it is something that I continue to hear from the people in Wyoming and the people across the country. We need to repeal and we need to replace with common sense solutions of allowing people to buy insurance across state lines. Make that legal to do that. To allow small businesses to pool their resources together, to give incentives for individuals who go to something like the Wyoming Health Fair and work on prevention and early detection of problems. Give those people the opportunity to make individual choices. Expand health savings accounts. Those are sorts of things that we can deal with in a responsible way to help American families get the care that they want from the doctor that they need at a price they can afford. That's all the American people are asking for. The care they need from the doctor they want at a price they can afford, and they are not getting it under this health care law. It's now been enacted for a full year. The American people know the truth. Thank you, Madam President, and I yield the floor.